welcome to the University of Findlay Art and Culture Show. I am your host, Sharinda, and today we have with us Ms. Tara Smith, who is the director of Cosiano Health Center here on campus. Welcome.
Thank you.
We are so glad that you could make time out of your hectic schedule to be in and visit with us. Oftentimes when we do interviews, it's of artists and entertainers that are touring and in our area, and then once in a while we have the opportunity to get with a director of a program or a center here on campus, but it's difficult because you're always so busy.
Yeah.
And we've been trying to get this connected for a while, so thank you for making time in your schedule.
Yeah, thanks for having me.
You are so welcome. The Cosiano Health Center is a gift to the University of Findlay. There are many universities and colleges that they don't have a health center on their campus,
Right.
especially commuter colleges. And so could you tell us a little bit about the Cosiano Health Center?
Sure. The health center is open Monday through Friday from 9 until 4. We don't close for lunch, so anybody can walk in. You don't need an appointment to come and see one of the nurses. Dr. Stump is there 8 hours a week. You would need an appointment for him. And then we also have a womankind clinic on Wednesdays. So you would need an appointment as a female to see her.
Okay, and so is the womankind, that's someone that talks with women about their personal health care?
Correct.
And some of the specific physicals that they would need if they're an athlete or if they have concerns about something internal?
Yeah, right.
Okay.
Any kind of female health issue,
Okay.
she can help with that. There is a charge to see her, $50, cash, check, or credit card, but the rest of our services
There's
are
not a
free.
specific fee.
Correct.
That's wonderful. Now, is this open to the University of Findlay campus and the student population, faculty, staff, or does it go out farther in the community?
Yeah, so the Cosiano Health Center can see students and employees and the dependents of the employees for free.
Wonderful.
So this is very different from a lot of other college health settings.
Is, because even if there is a healthcare provider, there is a minimum charge
Right.
just to walk in the door.
Right.
So that's wonderful. Now, do you work on a grant system? Is there specific monies that have been allocated through families who have appreciated the services over the years, or is this something that's a commitment by the board of directors through the University of Findlay?
Yes, this is offered because of the University of Findlay. So when we go to other, college conferences, they're just amazed that we offer a free service not only to students, but to the employees.
And I know that it's a wonderful benefit to the employees, because if we're thinking that we may have sniffles that might be leading into a sinus infection, that would be a $7,500 fee
Right.
to go see a doctor, and we're able to set up a time to come in and see one of your amazing nurses.
We do have a good staff.
Oh my
Yeah.
gosh, they're just awesome.
Yeah.
Or the doctor, and then we still pay for our prescription.
Right.
And if there's any blood work, we still pay for that, but we're not paying for that consultation fee.
Right, right. So a lot of times, especially for employees have younger children, is it strep throat? Is it just a cold? Even
Mono.
students, yes. So we can check all of that for free. Their insurance is not going to get billed for a quick strep in the office. We can check for a bladder infection for free.
And I think you've done kidney also,
And
right?
it would show,
Yeah,
on
yeah.
that strip. So it's the easiest health care. We tell the students all the time, this is the easiest health care you will ever encounter. And we care about you. We tell them
That
we're
is
your
very
mom away
true.
from home. We all have kids who are still in college or have graduated, and we know what it's like to be away from home and have our kids, not be right there with us. So
And looking for some sort of support.
yes.
And I know another thing that I've heard students talk about that they really appreciate is the fact that within taking that time to listen, oftentimes you're able to help gear them towards services that they might need on the counseling side of things. If you
Right.
see signs of depression, or you see signs of something else that's coming to fruition due to a stressful time in their lives, and then you're able to connect them with our health counseling services on
Right.
campus. You work hand in hand with counseling services,
Right.
correct?
Yes, because sometimes students will come in, just having vague symptoms, it comes out physically. Our mental stress can come out physically. So they're afraid to go to counseling for whatever reason, and so we talk with them and, just give them assurance, and it's okay. And sometimes we make that phone call right then and there to counseling and get an appointment set up with them.
Well, and I think that there's a little bit of confusion for families that are at home as well as for the students on campus, because we hear so much about FERPA and we hear so much about confidentiality, and that things can get shared in certain situations and scenarios on campus, that sometimes there's some confusion on where the health center and counseling services stands with confidentiality. Could you touch on that a little bit, please?
Yes, so the health center, along with counseling and the ministry services here on campus, we're all confidential places and resources that students can go. So if they've had something happen, they don't have to be afraid that we are going to report it to the police or Title IX or anybody. We are confidential. So if a student comes in with anything, we can't call a parent even and say, hey, they're sick. We say to the student, please call your parent and let them know you're sick, because when they call here, we're not going to be able to give them any information unless you sign a release. But there are other things that happen in life that a student wants to feel safe, and so they can come to the health center and know that we are confidential and we're not going to report anything.
And that is wonderful to know and reassuring, I'm sure, for individuals who are questioning that.
Right.
Now, in addition to providing health services, you're also very active on campus with preventative measures as well as educational measures.
Right.
And if a student walks into your facility, they're going to see some wonderful posters up that are explaining to them and asking them questions that they maybe need to be thinking about. Could you touch a little bit on some of those posters and some of the education campaigns that you work on throughout the academic year?
Right, so some of those posters are internal, like they're ours for our Womankind Clinic or Title IX confidential reporting. But other times, like we work with supporting a health fair every year and bring in community resources like the Women's Resource Center and the hospital, and try to give educational pieces to students where they can go if they need something beyond our services.
And the times and availability that they're accessible in the community.
Right.
And then there's another amazing piece that you're tied to as a health center, and that's Colleges Against Cancer. And Colleges Against Cancer is a student organization, student-led, student-driven organization that's tied to
the American
Cancer Society?
Yes, thank you.
I just wanted to make sure I was correct. I didn't mean to put you on the spot.
No,
Sorry about that.
No, it's okay.
But then they as students are responsible to find advisors that are full-time faculty or staff members. And they approached the Cosiano Health Center many years ago and asked for the support of staff as advisors. It was a perfect fit with health education. So what are some of the programs that they spearhead but you provide the support for on campus? Because a lot of people hear about the walk, but they don't know all the other amazing things that are happening on campus.
Yeah, so this was the 12th year for the Relay for Life that unfortunately was online, but they were able to raise over $19,000.
Oh, that's amazing.
And it's just college students. And
the
it's
teams
amazing.
they form.
Yes. So I believe there were 28 teams and 233 team members to raise that much money. I think that's awesome for college students.
Oh, yeah.
So they will host at the beginning of the year in the fall, like around in September, they will do an opening, like an ice cream social or something, to get students aware that we do have a great team here with Colleges Against Cancer.
And I think that's called Chill Out
Yes.
with CAC, where they
Yes.
serve either ice cream or popsicles or snow cones.
Right.
Something nice and cool and refreshing.
Right.
It's such a fun event.
Just to get them like,
Connected,
okay, this is
yeah.
cool, you know? And then in October, they do bowling for boobs at the local Sportsman's Lanes. And
Student Government Association helps underwrite the
Yes.
funding for that, so
Yes.
the students don't have to pay to play.
right, right.
And then CAC and your center help with the educational materials,
Right.
and there's promotional things done at that
Right.
time.
Yes.
So they don't just go in and play and get a shirt that says bowling for
Right.
boobs. There's more to it.
Right.
So what are some of the information that is offered and prepared for that?
So it will talk to women about monthly breast checks, men about testicular health, and then, also about skin cancer and just all the forms of cancer that is out there and what you can do.
And how you can pay attention.
And yes, because as a young person, you think you're invincible and this is not the time to worry. But if you take care of your health now, those are great habits all through life. So they educate them about all that's involved with any kind of cancer.
Wonderful. And then is there another event that happens later in the year besides the walk?
So the Bowling for Boobs is October, and then March is the relay, the walk.
The walk.
Yes.
So you have two major events, but in between, the group is always meeting and
Right.
brainstorming ways that they can get information out and recruit teams for
Right.
the relay.
Right. In Hancock County, this is the only relay we have, which I think says a lot for our university students to be so involved.
Well, and community members may join those teams
Right.
and may participate. And
Right.
I had the honor of attending last year's with my doggy.
Yes.
Mishka is canine cuddler here on campus. And I was really touched with the survivors lap, and then also the Luminary
Right.
lighted walk. Could you touch a little bit on what the Luminary lighted walk is about?
Yes, so that is a special time during the relay, during the walk, that you can honor somebody who is a cancer survivor, and then in memory of somebody maybe who has lost that battle. And it's very touching.
It's extremely
Yeah,
touching.
because those bags line the track.
And they're so beautiful.
Yeah.
And they're so quiet,
Yeah.
but they're so strong.
Right.
It's just so special.
Yeah.
And then meeting and seeing so many people that are in their fight right now or in recovery that are out with their teams, their nucleus that's helped them through
Right.
that is really special also.
Yes.
And I'm often surprised at the people that are in recovery that I didn't know went through that battle.
Right.
But to be able to celebrate with them, and the fact that this is not private, I'm here to give a message to others. You can do this, and it's
Right.
okay, and this is not something to be ashamed of. Because that's a lot of the stigmas that go along
Right.
with cancer and the challenges of it, not on purpose.
No.
It just happens with the mental fatigue and some of the reactions we receive from others. So it's just a great opportunity to come together and support and celebrate.
Yes,
And be
exactly.
educated.
Right. Yeah.
So there is something else that the health center kind of took point lead on a couple of years ago. We started hearing more information about the uptick in lung disease tied to smoking and vaping.
Right.
And so at that point, the center started reaching out to the rest of the university campus, doing some studies and things on what the community of the University of Findlay felt should be our stance
Right.
regarding smoking on campus. And we had quite a positive response.
Yeah.
A few would say it's negative.
Right.
But it impacted our campus with some new rules and regulations here on
Right.
the campus. And those rules and regulations pertain to anyone that comes on campus,
Right.
which in past, they've been, sometimes the rules have been for campus attendees and maybe not community, but this is a hard and stand fast rule.
Right. We are tobacco free.
Tobacco free,
Yes.
and that's been 2 years now.
Yes.
I know that when the school first decided to do this, they did an amazing positive campaign explaining the decisions and the reasons, and they had data to back it up because of all of the different interviews they did, as well as surveys they did of both the university students as well as faculty and staff.
Right.
But what does this rule mean when we say tobacco free?
So, you cannot smoke, you cannot vape, you cannot use any form of tobacco.
Chewing tobacco?
On university campus, yes.
And so what if I'm in my car?
Not on university property.
Right, right. And that's where community members need to be aware of
Right.
that. Because we also have a police department
Correct.
that is a police department, and they are able to ticket for that. They don't want to.
Right.
But
Right.
it is a law for the University of Findlay
Right.
community.
Right.
Now, does that include our farms and our extension campuses also?
Yes.
Okay.
Any part of the university campus is
Okay.
tobacco-free.
Okay, good to know. So if I come in as a family member for a graduation and I'm a smoker, I can't stand
can't,
outside the
no.
building anymore and smoke.
No,
I've
right.
I've got to cross the street or go to someplace else
Right.
before coming to campus.
Yes, yes.
And then chew a bunch of gum until I can leave
Yes,
campus.
right,
Okay,
right,
all right.
right.
So thank you for clarifying that. And I'm thankful that our campus has responded as positively as it has.
Right, it has been a positive endeavor, and we just want to be healthy and keep everybody healthy.
So you had mentioned Dr. Stump, and you'd mentioned that you have a staff of nurses. How many nurses are employed at the center?
So there are a total of 3 of us.
Okay.
Yeah.
And are they all full-time? Are they full-time and part-time, and their shifts stagger? How does that work?
We all are registered nurses and are full-time, working Monday through Friday from 8:30 to 4:30.
And I know another thing that Missy works on, she's one of the nurses there, is the health programs for faculty and staff. The challenge is to stay fit, to keep our weight down.
Right.
And that ties into some of the goals that the center has set for us as
Right.
a community.
Right.
So there is always something
There's
going
a lot,
on.
yes.
It's not just the walk-ins.
Yes.
There's preventative measures. There are paying attention to our campus community as a whole.
Right.
And then you're also on another committee on campus that I'd like to touch on just a little bit. If we would have a health concern that would spread through the campus, what's in place to help you support the students, but also for you to receive support in helping with combating something like that?
Right. So the university campus has an emergency response team that encompasses lots of different
Scenarios.
Yes, and different offices are involved. It's not just a few people. So we work together to try to come up with, and there is a crisis plan in place if anything would happen, health related or otherwise.
And I'm sure that each of those crisis plans are tweaked a little bit according to all the different scenarios that your team has dreamt up, as well as I'm sure that you've had other offsite sources that have provided some insight on what possibilities there could be.
Right. We work closely with Blanchard Valley Hospital, our Hancock Public Health. It's not just one entity involved with a health crisis.
So with a health crisis, if someone watching wanted to know or be able to follow what precautions are being taken or what's happening within our campus community as well as the greater community, would Hancock County Health be the best way for people to follow that information? Are they taking their direction from the governor's office, or would they contact the health center? How does that work?
Anybody can always call the Cosiano Health Center to get information, and we can guide and direct them where the best place would be.
And what is that phone number?
419-434-4550, and our email address is cosiano@finley.edu.
And will you please spell Cosiano,
Yes.
because it can, some people pronounce it Cassiano, some Cosiano,
Yeah,
and
good
if
point.
they're phonetic spellers, sometimes that can get
Right.
a little confusing.
Right. So it's Cosiano.
Okay, thank you.
Yes.
So it's Cosiano at finlay.edu. Okay,
Yes.
thank
Yeah.
you.
And then, we get our direction a lot of times from our local health department, and they get their direction from the governor.
Okay. And then the local health department also has contact availability,
Right.
and people can go online and just Google that,
Right.
I'm sure.
Right. Yeah. And they will have updated information, and we have a website within our University of Findlay website, so they can look at information there as well.
Wonderful. Well, thank you so much again for taking time out of your schedule, Tara, to help us learn as well as be exposed to all the wonderful things the Cassiano Health Center is doing for the University of Findlay. And then in return, that is going out into Hancock County in Northwest Ohio. I know that the fundraising through the walk annually, that all of those funds stay in Northwest Ohio,
Right,
correct?
right.
To make a difference in the research and development and the protection of our individuals fighting and battling cancer.
Right.
So thank you for what you do and for what your team does and for how you advise so many students, from athletes to students involved with leadership development on campus to our international population. You guys are a touch point for everyone.
Yeah.
So thank you for what you do.
Oh, you're welcome.
And thank you for tuning in today. We look forward to the next time we're together. Until then, be well.